PowerPoint presentation is part of Unit 4, Understand the Factors that can influence communications and interactions with individuals with dementia. It's part of the Level 2 Dementia Awareness and it's run by Plato Training. The aims and objectives of this session are to gain an overall understanding of how to adapt your style of communication to meet the needs, strengths and abilities of an individual with dementia to allow them to enjoy and live the best life they can. To understand how a person-centered approach may be used to encourage positive communication with individuals with dementia. You will see that on each of the slides there is a green box, usually located on the right-hand side. This tells you which slide, which question each slide relates to. But it's also important to share your own ideas when you're working through the PowerPoints to expand your answer within your workbook. And just to remember that, the PowerPoint presentation, the slides, they're here to guide you. And it is good to do some further research to give you more understanding of the contents of each of the areas that you're going to be looking at, and also to help us to see your your understanding, and it shows you are able to do wider reading of the topics. We're going to now look at a slide which relates to question number 1, and it's about recognizing an individual's communication strengths and abilities. So how are we going to do that? How are we going to recognize their strengths and their abilities? Well, we need to find out as much as we possibly can, and the ways that we can do that are through observations and documentation. So by observing and monitoring an individual with dementia, we can do that discreetly. We can watch them and monitor them, and then we will document their strengths and their abilities when they're communicating, when they're socializing with others, when they're generally interacting with others. We can watch them, we can observe them, monitor them, and then document it so it's written down so that everybody knows how they communicate. So we'll share the findings in a confidential manner. Obviously, we've got to be confidential, but we'll share them with the team so that they have a thorough understanding of how to meet that person's individual needs. Spending time with the individual, with their family, their friends or their loved ones, to gather as much information as you possibly can on that individual's preferred method of communication. So offering accurate support and techniques, and if they need any aids. So for example, you could use picture cards to help them communicate. These objects of reference such as hobbies, equipment. So if you know that they're interested in football, you could talk about football. You can communicate with them about their preferred what their interests are. Any photographs so they can reminisce on memories and past times, and one-to-one time enjoying activities with the individual to encourage communication and their interaction. And question number 1 is asking you to explain how to identify the communication strengths and abilities of an individual with dementia. Think about the last slide and also do some of your own research, and then ensure you put it into your own words. This slide relates to question number 2, and it's looking at preferred methods of communication which can help to communicate with individuals with dementia. So, it's looking at what preferred methods you can use. So we are all different and we have our own way of communicating. So it's really, really important that we know about individual needs so that we can adapt our style of communication with them. So some people are noisy and chatty, whilst others are quiet and calm. Some use different facial and body language, some are still and hardly move. So it's important that we have an understanding and as individuals' preferred methods of communication, because it will allow you to be as effective as possible when you're communicating with them, and it will also allow the individual to reinforce their identity and their uniqueness. And question number 2 is asking you to describe how to adapt the style of communication to meet the needs, the strengths and abilities of an individual with dementia. And you'll see here, there's a tip to look back at the answer to the previous question, which was question number 1, and think about what you will do with the information you have found out about the individuals with dementia. So the next few slides relate to question number 3, and it's looking at, again, using preferred methods of communication to help support individuals with dementia. So it can be easy just to see the illness of a person with dementia, and this then means all of the aspects of their life just disappear because you're just focusing on the illness. The personality, their humour, their achievements, the kindness and family life can all be lost. So working in a person-centred way recognises people for who they are, and that people are valued for who they are and all the important things that are still there. Identity is what makes people who they are. Everyone has an image of themselves. This could be a positive image overall or a negative, but a great many factors contribute to a person's sense of identity. For example, the gender, the race, their language, religion, the family, the friends, the culture, the values and beliefs, and the sexuality. All of these factors are aspects of our lives that contribute to the idea of who we are and our uniqueness. By recognising everyone as unique, this reinforces you knowing how they prefer to communicate and what their strengths and skills are. By asking others for information and taking the time to find out about individual communication methods, you're putting them the centre of your own practice. So if individuals with dementia are communicated with using their preferred method of communication, they could feel more in control of their condition. The person caring for them will show they understand their individual needs, symptoms, and how to react to their behaviour and actions. So by having a good level of understanding of an individual's preferred method of communication will allow you to interact and promote familiar conversation. It will allow you to discuss likes, hobbies and interests. This will promote an individual's identity and uniqueness. Successful communication is positive for individuals with dementia because it will promote a calm atmosphere, making the individual feel less confused and comfortable in his or her environment. The individual will feel respected and feel understood. It will also reinforce their confidence and their identity and uniqueness. And question number 3 is asking you to describe how information about an individual's preferred method of communication can be used to reinforce their identity and uniqueness. And you'll see there's a tip. So think about self-image and a person-centered care and support. And this brings us to the end of the PowerPoint presentation. And now you've completed the session, you should be able to gain an overall understanding of how to adapt your style of communication to meet the needs, the strengths and abilities of an individual with dementia to allow them to enjoy and live the best life they can. You will be able to understand how a person-centered approach may be used to encourage positive communication with individuals with dementia.